I think it's crazy that we have a separate system where we've got funding for physical health, and then we've got social care, which is completely funded differently by the local councils. And I think social care, when we talk about social care, we forget that mental health is meant to be part of social care, but they tend to be very much separated off. So you've got separate funding sort of pots, mental health and social care, and I think it's very easy to forget about the mental health side and the impact that has on people's physical health. I'm also in the thyroid club, and just to bring it up to speed, Jackie was saying that if you're receiving thyroid, you get an exemption to your prescriptions, yet that applies to all your prescriptions and everything. So it kind of made sense to me, as I'm in that club too, that actually, yeah, it should really only be for the thyroxine that I require, not every single medication. So that does make sense. But I wouldn't be for a flat rate charge. I think when we've got people going to food banks struggling to get a meal, I think £2.45 to them is certainly a meal, possibly two. So I think that needs to be rethought. I think there's a massive divide. I think we're all talking about patients or service users or carers, and yet we're all in a room like the commissioners, and I'd actually move it on even further. I think it's really important that when we're talking about patients, we're talking about people who have very varied backgrounds, and some who are very experienced in all sorts of different ways of life, have a lot to bring to the table. And I think the key point, talking about the politicians, won't do it. Well, hang on a minute. It's the public that decides, what the politicians are going to say, and they want to please the public. So I think if you want to raise the public debate and get the public really facing the hard questions, which we're going to have to face at some point, then you need to start including them in the decision-making process.